Hello everyone, welcome to fourth session of AIMS or INI-CET 2021 November recall question discussions. So in this fourth video we are starting with question number 31. So this is column matching. Column A is for bone pathology and column B is treatment option. So what are the treatment option for bone pathology? So proper match the column properly. So for simple bone cyst, proper matching is intralesional steroid. So for simple bone cyst, intralesional steroid. For osteoid osteoma, it is radio frequency ablation. For GCT or giant cell tumor, it is curettage. And for osteosarcoma, it is nothing but white excision. So this is the matching: simple bone cyst, intralesional steroid, osteoid osteoma, radiofrequency ablation, GCT curettage, and osteosarcoma white excision. Coming to question number 32, what is the characteristic of Langerhans cell histiocytosis? LCH, Langerhans cell histiocytosis. So classical features is Birbeck granules, tennis racket cells with Birbeck granule. So this is for Langerhans cell histiocytosis. Coming to question number 33, this was clinical scenario based question. Drug of choice for post-menopausal women with Colles fracture, DEXA scan showing T-score of -2.5. What is the proper management plan for this female post-menopausal woman with T-score -2.5? So this is osteoporosis in a post-menopausal female. And what is the right management for this case? Start alendronate. So this is the answer, alendronate, one type of bisphosphonate group of drugs. So this is the answer for this question. Coming to question number 34, a 62 years old male peripheral blood smear is showing smudge cell. So this was the clinical clincher in this clinical scenario based question. This is suggestive of CLL, chronic lymphocytic leukemia. And what the question asked was, what is the next best step for diagnosis? In this case, the best step will be flow cytometry. Following peripheral blood smear, after identification of smudge cell, it is indicative of CLL, and next best test for diagnosis is flow cytometry. Next, a patient presented with femoral shaft fracture. What all are needed to put a skeletal traction? So what are the things that is needed for skeletal traction? Number 1 is Wohler stirrup, number 2 is Steinman pins and Wohler's frame. So these things are required for skeletal traction. Denham's pins is not required. This is required for osteoporotic porous bone. Thomas splint and KO are not required. So Wohler stirrup, Steinman pin and Wohler frame. Next, coming to question number 36, procedure shown. So this was the image given in today's exam. So what is the procedure? See the marking: sternocleidomastoid, internal jugular vein, common carotid artery, vagus nerve. Okay, so this is the procedure, imaging procedure. This is nothing but USG neck. So this is ultrasonography neck, USG neck. Next, question number 37. This was also clinical scenario based question. Patient with tibia fracture, plaster done. After removal of plaster, patient is complaining of pain. There is pain on passive extension of great toe and there is loss of sensation of first wave space. So there is compression of actually deep peroneal nerve. Deep peroneal nerve supply anterior compartment muscle like extensor digitorum longus, extensor hallucis longus. So there is pain in passive extension of great toe or like during action of extensor hallucis longus, and there is loss of sensation of first wave space. This wave space is also supplied by deep peroneal nerve. Deep peroneal nerve is a nerve of anterior compartment of leg. So anterior compartment. So deep peroneal nerve supply anterior compartment, superficial peroneal nerve lateral compartment, and posterior tibial nerve supply posterior compartment of leg. And on examination, posterior tibial and dorsalis pedis pulse is normal. So what is the next step? This pain on the stretching is indicative after plaster is indicative of nothing but impending compartment syndrome. So impending compartment syndrome. So in this case, the proper next step will be measure anterior compartment pressure, as there is pain in passive extension of great toe or anterior compartment stretching pain. So measure the pressure of anterior compartment. If the pressure intercompartmental pressure is more than 30 millimeter mercury, then fasciotomy should be done to release pressure. Otherwise, there can be sequelae of compartment syndrome. Then fluorescent in situ hybridization fish is done for which hearty new status of breast carcinoma. This is easy question, repeat question from previous year AIMS question. This is +2. This is previous year question, I think from NEET or AIMS paper. This question was previously asked. So +2. Question number 39 was also clinical scenario based long question. So fall from height, treatment with cast, patient then cannot walk properly, he has to bend towards the affected side. So he has to bend towards affected side to walk properly. So what is the affected structure? Actually one cadaveric image was given and structure marked was ABCD, and the question asked what is the structure that is damaged or affected. In this case, this is nothing but a clinical scenario of Trendelenburg sign actually. So this is nothing but Trendelenburg sign. In this case, sound sites actually sings. So what is the affected structure? The affected structure is nothing but this muscle. This is actually gluteus medius muscle. So gluteus medius and gluteus minimus supplied by superior gluteal nerve. Superior gluteal nerve damage can cause Trendelenburg sign. These muscles are abductors of hip joint. Then question number 40, boy with neck swelling, histology is showing starry sky pattern. This starry sky was the clinical clincher. This was clinical scenario based question. And what is the gene responsible for this condition? This is nothing but classical condition of Burkitt's lymphoma. So this is Burkitt's lymphoma, and the gene responsible for Burkitt's lymphoma is nothing but MYC gene, CMYC gene, c-MYC gene, CMYC. So this is the gene responsible for Burkitt's lymphoma. In the next video, I am going to discuss question number 41 to 50. Till then, subscribe my channel and don't forget to share the video with your friends, juniors and seniors. Stay tuned for the next video. Thank you for watching.